Common disease symptoms during the rainy season include respiratory distress, nervousness, diarrhea, lost appetite, ruffled feathers, swollen face, and too many to mention. These symptoms may be associated with different diseases, which make it difficult to carry out proper diagnosis. This rainy season also affects both quality and quantity of feed and feeding. All these and many more factors affect the production of birds, both in egg production known as layers and meat production known as broilers. On this video, I will discuss to minimize the loss during this rainy season. Just follow through till the end because every second of this video is very vital, and at the end of every disease talked about, there is an important tip you don't want to miss. Another reason you shouldn't skip is that if you are to use drugs, I listed some active ingredients you should look out for in every drugs that you are buying for the diseases that I'm going to talk about, and they are very, very effective. What's up, my people? Welcome to Life of a Farmer Loaf, where we discuss farming in details. I remain your anchor, Ishokri Ovokironyi. You can call me Ovorans. I sincerely appreciate all my old and new subscribers, and if it's your first time of coming across my video, you are welcome. Please don't hesitate to subscribe. Turn on the bell icon for prompt update. Also like, share, and drop your questions in the comment section. Without wasting your time, let's dive into the main cocoa. The first disease that is rampant among poultry birds during the rainy season in both young chicks and adult birds is coccidiosis, and its main site of infection is the intestine, causing damage to the intestinal mucosa. This is the reason your birds exhibit various clinical signs such as bloody feces, ruffled feathers, anorexia, less water consumption, and many other symptoms. Mortality can increase to 100% if not treated because the immune response of birds will be damaged, making them more susceptible to other diseases. The best solution is prevention, and here are the best tips to prevent it and also a curative approach. 1. Avoid overcrowding. Overcrowding will make your pen to wet often from the bird's feces, thereby creating room for cocci to thrive. Then 2. Provide clean and fresh feed and water regularly. 3. Provide medicated starter feed by introducing anticoccidial medication around 12 days of age. This can also depend on your vaccination schedule. You can also use cocci vaccine if available. Then 4. The best practice during rainy season is all in, all out. By so doing, all your birds come in at the same time and all leave the farm at the same time. In the situation whereby your birds are infected with coccidiosis and you want to use synthetic drugs, the best drugs of choice for treatment in cases of outbreak that are very effective are the sulfaquinoxaline and amprolium, which is usually administered at 1 gram per liter of water for amprolium. But if you are using any of the sulfur drugs, you have to administer it for 3 days, then you give plain water for 2 days, and you start the administration again for another 3 days. Another drug that is very effective is the toltrazolone. Then, in cases of bloody stool, vitamin K at 1 gram per 5 liter is very effective and should be given all birds once there is an outbreak. The sixth and the most important one is use of herbal plants. These herbal plants are very effective, and my best advice is to start as early as possible when they are very young, as it has no side effects. To know the most effective and best herbal remedy to use, you can click the top right corner of your screen right now, or better still, I will drop the link in the description box. The second common disease in rainy or cold season is Newcastle disease. This is another deadly viral disease that affects all ages of birds. This disease targets respiratory and nervous system of the birds with common signs that are similar to chronic respiratory disease, and they include coughing, sneezing, and respiratory distress. If the nervous system of birds are attacked, the birds show symptoms of torticollis, wing paralysis, difficulty in walking. There is also persistent chalky white diarrhea in affected birds. There is bound to be crash in egg production in laying birds. To avoid this, prevention is the key, and the first step to this is to vaccinate your birds. This is usually done via water orally or by injection. To know the right and best herbal remedy for Newcastle disease, you can check out my video on the 3 most effective herbal remedy for control of Newcastle disease in poultry. I will drop the link in the description box, or better still, you can click the right top corner of your screen to watch it. Please, if you are getting any vital information so far, kindly subscribe if you are yet to. Turn on the bell icon so that you won't miss future upload. And don't forget to give me a like and share for others to benefit. Thanks. A third rampant disease during rainy season that most farmers don't know. In fact, they waste money for drugs when they can spend little or no money to cure it. It mostly affects young and fast-growing broilers and turkeys in rainy season during the first 5 to 7 weeks of age. This disease is called ascites or water belly. Though it is a non-contagious disease, but it is worth combating as mortality can range from 0.5 to 2% of the flock. It is mostly caused or influenced by genetics, breeding, nutrition, growth rate, ambient temperature, and oxygen content of the air. You now see that all these causes can be controlled with little or no money at all if you know the root cause. High ammonia level is also a factor. This leads to accumulation of fluid in the abdominal cavity and neck region. At this stage, birds stop feeding and drinking water. They become depressed, emaciated, accompanying with respiratory distress. Production and growth is also affected. The best ways to prevent it are as follows. 1. Ensure proper ventilation to avoid buildup of humidity and ammonia in the broiler pen. Then 2. You can give pellet feed to your chicks instead of mash. And 3. Ensure to meet the best protein requirement. Then 4. By simply administering vitamin C or liver tonic can help to reverse the ascetic condition. Then the 5th and the last point is to subscribe, like, share and comment. Don't forget to turn on the bell icon. Watch out for part 2. Thanks. See you in my next video. Peace out.